Breast thermography has now came to Overland Park in the Midwest. Thermography in the Midwest is very vital to your breast tissue health screening regimen. Thermogram Clinic by MRL can be reached at 1-844-248-7463 or via the web at www.breastthermographykansascity.com. The information provided through this website and presentation should not be used for diagnosing or treating a health problem or disease. It is not a substitute for professional care. If you have or suspect you may have a health problem, you should consult a healthcare provider. Breast thermography offers women information that no other procedure can provide. However, breast thermography is not a replacement for or alternative to mammography or any other breast imaging. Breast thermography is a risk assessment tool that is meant to be used in addition to mammography and other tests or procedures. Breast thermography and mammography are complementary procedures. One test does not replace the other. All thermography reports are meant to identify thermal emissions that suggest potential risk markers only and do not in any way suggest diagnosis and or treatment. Studies show that the earliest detection is realized when multiple tests are used together. This multimodal approach includes breast self-examination, physical breast examinations by a doctor or practitioner, mammography, ultrasound, MRI, thermography, and other tests that may be ordered by your doctor or practitioner. MRL is a research laboratory that tests human specimens but does not report patient-specific results for the diagnosis, prevention, or treatment of any disease or impairment of, or the assessment of the health of individual patients. The laboratory does not provide medical diagnosis. If a client needs diagnosis, they should consult with their physician. Medical infrared imaging used as breast thermography, a new approach to prevention and soft tissue health screening. Who is at risk for breast cancer? All women are at risk. 1 out of 8 will develop breast cancer in their lifetime. 75% of cancer occurs in women with no family history. Additional risk is associated with family history, increased lifetime estrogen exposure to the breast. Why is early detection so important? It allows us to catch changes in the soft tissue health. This can mean the difference between a lumpectomy, a mastectomy, chemotherapy, radiation, or none. Life and death. On the image on the right, you can see the left breast has an inflammatory breast cancer missed by mammography in this patient. Problems with current screening. No significant decrease in the death rates over the last 30 years. Approximately 440,000 women died last year. No screening protocols for women under 40, while 15% of cancers occur in women under 45. Fast-growing tumors can appear between examinations. Smaller early-stage tumors are more difficult to detect. Dense or large breasts are difficult to image, making thermography a great option. Cysts and other benign diseases can cause confusing results. Breast thermography, one of the soft tissue health screening tools. Breast thermography analyzes the temperature and vascular patterns of the breast for abnormalities in breast tissue health. Breast thermography is extremely sensitive, 90% accuracy. Breast thermography uses no radiation and procedures, no discomfort to the breast. An abnormal breast thermogram is considered one of the highest risk markers for the future development of compromised breast tissue health. Breast thermography for soft tissue health. Breast thermography is not affected by breast size, shape, density, implants, reductions, or cysts, which can affect other types of imaging. Breast thermography can be done more frequently than other examinations to monitor high-risk women more closely. Here you have a grayscale image above the color image. Thermograms are focused in grayscale, and then with a click of a button, they are turned into the color scale. As we were able to focus in on grayscale much better than using color scale to focus in on during your thermogram. Breast thermography, it can possibly detect signs of developing soft tissue health abnormalities up to 10 years before they can be identified by other breast tissue health screening methods. It can identify women at higher risk for breast tissue health abnormalities regardless of family history or other factors. Breast thermography can be performed on younger women under 40 who currently have few options for screening. It can also signal a hormonal imbalance in the breast, such as high levels of estrogen, increase a woman's risk for developing compromised breast tissue. Hormonal imbalance. Recent studies from the National Cancer Institute have shown that breast tissue levels of estrogen may up to be 50 times higher than those found in laboratory blood tests. The pretreatment images display a specific vascular pattern typical of estrogen dominance, progesterone deficiency. The post-treatment images show a significant improvement after 6 months administration of transdermal progesterone. The implications into breast tissue health are significant. On the left, we have the before treatment, which is the pre-treatment images that display specific vascular pattern typical of estrogen dominance. The after treatment, on the right, you can see that on the color images, both tissues are symmetrical and appear cooler with the blue and purple coloring. How is breast thermography performed? The breast thermography examination is performed in a climate-controlled environment of 68 degrees Fahrenheit or 20 degrees Celsius. The patient is positioned in front of a specialized medical infrared imaging equipment which captures the images. Then a computerized analysis of the images is performed and they are classified in terms of normal and abnormal and rated for severity. The top image is a normal breast thermography. The bottom image is an abnormal imaging. In this one, we have tissue health in the left breast, as you can see with the redness that it has there. This was missed by a mammogram. How accurate is breast thermography? Some studies indicate 90% accuracy rate on detection of abnormal breast tissue health. When combined with physical examination and mammography, 95% of abnormal breast tissue health abnormalities were found in some studies. When breast thermography indicates the first sign of a developing abnormal breast tissue health, survival rates have increased significantly in many studies. How is this different from a mammogram? Mammograms look for a massive cell structure large enough to be seen. Thermograms evaluate how the breast is functioning by detecting the subtle chemical and blood vessel changes caused by growing abnormality. Both examinations provide important information, but one does not replace the other. Typical patients. for breast thermography that are screened. Healthy women over 20 looking to assess their current breast tissue health, women with fibrocystic breast or other benign breast diseases, large breasted women, or women with augmentation who may be experiencing difficulties with other imaging procedures, women with a lump or other breast conditions looking to evaluate it further, breast cancer survivors monitoring for possible recurrence. What this means: using thermography to identify high-risk women. It allows for more careful monitoring. It allows for earlier detection of compromised breast tissue health. It ultimately saves breasts and lives. When a thermogram is abnormal and all other tests are negative, a woman is given a chance to change her future by working with her doctor to lower risk factors or her practitioner, using thermography to help evaluate the success of any intervention or treatment. The next step: women should be proactive with their health and stay informed. Ultimately, every woman is responsible for their own health. All women over 20 should be evaluated by thermography to determine the risk for developing breast tissue complications. Combine thermography with your regular breast tissue health care to yield up to 95% detection rates of compromised breast tissue health. Educate family, friends, and the community about breast thermography to help save lives. Here are the references. Sources: Dr. William Amalu. His information can be found on breastthermography.com. Note: breast thermography offers women information that no other procedure can provide. However, breast thermography is not a replacement for or alternative to mammography or any other form of breast imaging. Breast thermography is a risk assessment tool that is meant to be used in addition to mammography and other tests or procedures. Breast thermography and mammography are complementary procedures. One test does not replace the other. All thermography reports are meant to identify thermal emissions that suggest potential risk markers and do not in any way suggest diagnosis and or treatment. Studies that show the earliest detection is realized when multiple tests are used together. This multimodal approach includes breast self-examination, physical breast exams by a doctor, practitioner, mammography, ultrasound, MRI, thermography, and other tests that may be ordered by your doctor or practitioner. MRL would like to thank you for listening to this presentation on breast thermography for the Overland Park, Kansas, and the Midwest thermography services that we provide.